Okay, I think it's time to get started. Looks like there's only a couple of people left in those breakout rooms. I just wanted to introduce myself quickly. I'm Megan Bloomingdale, and I'm the program coordinator for the EMT class. Again, as Gina mentioned, we are up at North Seattle College, and I think have been there for about 40 years, probably just over 40 years. I actually took the class myself there 26 years ago. It's been a great career because I get to circle back and run the class there. So really excited to share with you about that and kind of talk about how to get into the class, what some of your job options are. And honestly, that's just a really, really awesome stepping stone to so many other things that you might want to do. Spencer is here as well, and is going to help me. I'm a little bit worried that I'm going to have some technical difficulty. So if Zoom crashes on me or something happens, there'll be a slight pause, but I've got my Chromebook right next to me. And so I'll pop over to that right away. So hopefully pretty smooth transition between the two, but just kind of wanted to give you that quick heads up. I also have my old dog sitting next to me. She is 15 and snores like an old man. So I'm hopeful you can't hear that. But if you hear a buzzing noise, that's probably what that is. The first thing I want to do is start with a video that it's more of a recruiting video from one of our partners, from one of the ambulance companies in this region. So I want to play that. If it crashes, if it doesn't work, we're just going to move on to the PowerPoint presentation that I have. But I love this video. I think it kind of jazzes you up. It gets you excited about the job, and it's just fun to watch. Quick disclaimer though, the audio on it kind of hiccups a little bit. So it's not my computer this time, but it does kind of have a little bit of a glitch. So the music is kind of some rock music. It'll glitch just a little bit and kind of pick up along the way. I'm not sure how loud it's going to be to start though. So if you've got a headset on or earbuds, maybe turn your volume down a little bit. I don't want to blast your eardrum showing you this cool video. And I just want to make sure that my sound is going to work correctly. So I know that that can be an issue sometimes for people. Again, just a good video, kind of highlights a lot of the different opportunities you can have once you finish your EMT certificate. I'm just going to show this PowerPoint now. All right, our program is a 13 credit, 1/4 certificate. And as Gina was mentioning earlier, some of these certificate programs you can do in just 1/4. And after that quarter, you are immediately employable. We're 13 credits. So 12 credits is the EMT class and 1 credit is the co-requisite CPR class. You'll register for that at the same time you register for EMT. And then we host that just about a week before the quarter starts. And that way you have your healthcare provider CPR certification before you enter the EMT class. Probably with school, you already are getting CPR and first aid trained, but this is specific to healthcare provider CPR. The program is pretty rigorous. There's a lot of high expectations.
Megan?
Yep. Hello.
I think when you clicked view slideshow, it didn't show.
Oh gosh.
It's just frozen.
Oh, interesting. Okay, thanks so much. It's working on my end. So let me stop it and I'm going to give it a try again. Thanks for letting me know.
Okay,
it's good now.
Okay, thanks so much. Yeah, I was scrolling through. It was good on my end, so I really appreciate you. Okay, so again, that 13 credits and our program's pretty rigorous, but upon completion, you are qualified to take the National Registry exam for certification. In class, all of the skills testing required to be certified as an EMT happen in class. And then there's just a National Registry written exam. It's computer-based, so they still call it a written exam. Once you're finished with that, again, we prepare you for that certification exam, but once you're finished with that, you're able to go out and get a job. And I just think it is one of the best jobs in the world. As you could see from that video, hopefully, and there's just so many different opportunities. EMT is an entry-level job. If I'm being honest with you, it's entry level, which means it doesn't pay a huge amount. The starting wage for a brand new EMT is between $18.50 and probably $20 an hour. And certainly you get raises along the way. So it isn't something that you'll want to do for your lifetime career, right? It's not the type of job that you're going to want to support your family on, but it is absolutely one of the best places to start. And a pretty good wage if you're still in college. So that, that $18.50 to $20 an hour as you're in school. One of the really cool things about working as an EMT is the schedules are pretty flexible. They have 10-hour shifts, 12-hour shifts, and they have 24-hour shifts. So we've got some, there's some apartments in the area where if you're out running calls, you're in your ambulance. And then when you're not, you can go back to your apartment and sleep for a while. So even though $18.50 to $20 an hour to start, again, you can get some raises along the way, but even though that doesn't seem like a lot of money, you could do that job and only work 2 days a week, right? If you picked 2 24-hour shifts a week, you could do a whole lot of other things with that. You could just play if you wanted and you're still working full time. You could be in school full time, or you could have another job that you enjoyed doing. So a lot of wiggle room and a lot of different opportunities. You can work for fire departments, ambulances, search and rescue, ski patrol, just tons of options for you. At North, we offer the program every quarter. Right now, we're offering 2 different sections every quarter to just give some flexibility to the schedule. In the summer, because it's a short quarter, we only offer 1 class. That one, because we offer 1, it's a little bit more difficult to get into. And honestly, it's a little bit more rigorous because instead of 12 weeks, we have a class in 8 weeks. So some entry requirements to join the EMT class. You have to be at least 18 years old. You have to be a high school graduate or equivalent. You need to have a clean background check. And then I always need to give a heads up that to work as an EMT, to work for an ambulance, you have to have a driver's license. You have to have a clean driving record and a driver's license. So I want to just let you know that I do have a little bit of wiggle room with these entry requirements. Our entry requirements are based on the Washington State Department of Health rules for certification for an EMT. And they, with no exceptions, they absolutely will not certify somebody who is under 18 to be an EMT. And they will not certify somebody who has not graduated from high school to be an EMT. So my wiggle room with that is, if this is your senior year, we could grant you permission to enter the class. If you're super close to being 18, then we could grant you permission to be in class with that. The problem is if you're younger than, let's say 17, if you are younger than a senior in high school, what happens is the State Department of Health requires that you are at least high school graduate and are at least 18 years old to certify you. But if you haven't worked in a year, if you haven't been certified within a year of taking the class, you have to do some pretty rigorous retraining and recertification. So if you're 16 and you take the class, you can't be certified until 18, and you can't be certified within that year requirement. So we just don't recommend it at all if you're not close to 18 or close to graduating from high school. All right, so where do some EMTs work? Again, I think that video highlighted it pretty nicely and it looked pretty cool. So fire departments, all firefighters in this region are EMTs as well. Some are paramedics, which is a next level up from EMT, but all firefighters in this area are at least EMTs. Some police departments have EMTs working for them. Search and rescue, many of the search and rescue volunteers are EMTs. Ski patrol is a pretty cool one. So ski patrol has volunteer ski patrol, but they do pay. It's seasonal work, but if you like to ski or snowboard, you can get a free pass and maybe a little paycheck to work for ski patrol during the ski season. Ambulances, of course, hire EMTs, and then some clinics. So some emergency departments and some clinics hire EMTs as well. I worked in the emergency department at Valley Medical Center in Renton, and it was a really fantastic job. I had a lot of good experiences with that. Let me click back just really quick though, because I do want to talk about this. When I first started, I was mentioning, this is an entry-level job and it doesn't pay a lot. But again, I want to capitalize on this is one of the very best places to start. I want more for you in your career. So staying as an EMT, though doable, and I think would be a really, really fun career, I want more for you. And so if you're thinking about a career in medicine, think about the experience that you get working as an EMT helps you out on your nursing applications. If you wanted to go to PA school, physician's assistant school, if you wanted to be a doctor, the experience that you get working as an EMT gives you real patient contact. A lot of times the volunteer opportunities or entry-level jobs don't give you real patient contact, but working as an EMT does. And so many of our students, I would say at least 40% of our students want to have a career in medicine. And this is just a phenomenal place to start. So medical assisting or nursing or PA, physician's assistant or doctor. This is really just an amazing place to start. And again, in just 1 quarter, you can get your certificate and be immediately employable. One of the ambulance companies in our region is offering a $7,500 hiring bonus right now, and you only have to commit to work there for a year. So a lot of them are offering bonuses. One in particular is at $7,500 right now. And again, that's just for a year commitment and an amazing amount of experience. Our time commitment, so you're looking at pretty much a full load. I mentioned that we have 2 different cohorts. So our more traditional one is our evening and weekend cohort. I mentioned about 40% of our students are young and want a career in medicine. The other 60-ish% of our students want a career change and they want to be firefighters. So they want to be firefighters or paramedics, sometimes police officers, but they want that career in public safety. They're already working, many have families already, so that evening weekend option is more desirable for them. So our more traditional, it's not better, it's just more traditional, is our Tuesday evening. So Tuesday 4 p.m. to 10 p.m. Thursday, 6 p.m. to 10 p.m. Right now we're doing that on Zoom because that's a lecture. And then on Saturday, you're there all day. That's 8 to 5. Our other option, just as cool, we find that generally this is a younger group of folks that want a career in medicine or some want to be firefighters or paramedics. And this one happens during the week, kind of during the workday. So less desirable for folks working. Monday, 11 a.m. to 7 p.m. That Thursday, we're still doing the lectures 6 p.m. to 10 p.m. And then Friday, 11 a.m. to 7 p.m. So Monday and Friday, 11 a.m. to 7 p.m. is when we're in. EMT is hands-on. I think, as you can imagine, when you are taking care of people in life-threatening situations, you need to know how to do that and be able to do those skills with your hands. So it's not an online class, and we don't have an option for online at all. It's definitely an in-person hands-on class. But again, Thursdays, we do the lecture via Zoom. It's a better way to keep everybody safe and more socially distanced. All right, so what do you learn? Well, we learn how to take care of people in medical or trauma, life-threatening situations. Our EMT instructors have tons of experience. I think I'm one of the young ones there, and I have 26 years of EMT experience as well. So we just say our lead instructors, there's 3 of us who are leads, so over 50 years of combined experience teaching, as well as many, many years working in patient care, working out in the field. But we have about 30 lab assistants, and these lab assistants are EMTs or police officers or paramedics or firefighters who work out in the field. We are their second or sometimes third job. And so you're getting some real-time information from them. You might have somebody that just came from their fire department shift and they're able to tell you about the things that they learned and the things that they saw on their shift before. So real good substantial experiences are coming from your instructors, and they're able to pass that on to you so that you can help to learn. You're not just learning from a book, you're learning from experiences and some hands-on skills. Some of the things that you learn are going to be patient assessment. So how do we assess? How do we look at our patients to find injuries or signs of illness and make a plan on how to treat that, on how to fix that? So everything on this list here is specifically to our skills testing for your certification. So it's patient assessment, both medical and trauma. It's how to take vital signs. So how to take a blood pressure, how to take a pulse, how to take a respiration rate, and that falls under patient assessment. We will learn cardiac arrest, so some more CPR and the AED, that automated external defibrillator. We'll learn how to administer oxygen. So there's a couple different ways that we can administer it, and we can really help patients by doing that. There are some medications that EMTs are allowed to administer or assist with, and so we'll cover all 5 of those in class, and you'll be tested on that for your certification exam. We'll learn bleeding control and shock management. So if your patient's in a life-threatening injury, they've got a life-threatening bleed, you'll be able to manage that and take care of it. We've got splinting as well. So immobilization for a long bone, like a broken arm or broken leg, or joints, right? Wrists, knees, elbows, shoulders, things like that. So we'll be able to control our patient's injuries so that we can help them. We'll learn extrication extraction. So taking somebody from a car wreck out of the car, we'll be able to learn how to immobilize their spine. We've got a backboard, or we've got an extrication device that we can learn as well. And again, though we have a lot of fun learning these and practicing these on our classmates, these do count for your certification exam as well. So I mentioned a little bit about the careers and the jobs. Most of my students, again, are looking for public safety jobs, those civil service public safety jobs. So most want to be firefighters, police officers, paramedics. But again, some people want a career in medicine, and just based on the topic of this breakout session, I expect many of you would prefer that career in medicine. So this class really does give you an advantage on your applications to med school, nursing. There was one locally, and I'm not exactly sure what it was, but I know there was one local nursing school that was giving preference points to somebody, to other candidates that had EMT experience. So med school, nursing, PA, emergency department technician, and paramedic as well. There's some educational pathways as well. You might be thinking, well, I want a job, but I really want to finish college. And I don't want to discount how important it is to have that educational pathway and that degree. And maybe some of you just want a small amount of school and you want to get to work right away. I think that's great. I think it's good that you know that, and I think it's awesome. But in this program, there are a lot of opportunities to continue to grow. So you might choose to do EMT and do it for a few years while you kind of sort out exactly the pathway that you want to go. And then you can make other decisions along the way. But one of the things I think is amazing about our program is it does feed directly into some other some other educational programs and degrees. So you could take EMT and just stop there, or you could take EMT and then continue to grow with that. So for the civil service public safety jobs, if you think you're interested in that, we have a brand new program for fire science at North Seattle College. EMT fits directly into that degree. And again, that's the Fire Science Associate's degree. If you are interested in police work, they have a Criminal Justice Associate's degree at Highline. And then there's medical pathways as well. So North Seattle specifically has an associate's degree of applied science in allied health, and the EMT credits fit directly into that degree. Seattle Central College, as Gina was mentioning, there's a Bachelor of Applied Science there. So you could take the EMT credits, you could get an associate's at North and then transfer it into Seattle Central for your Bachelor of Applied Science if you want to do that. Or you could just take the EMT at North and then transfer into Seattle Central if there were other programs that interested you as well. But a lot of really cool pathways if you want to continue your learning. Our class is very rigorous though. And again, you can count on a full load. And I gave you the schedule breakout of that. So you know that you're in class 16 to 20 hours a week. So it is quite a bit. We have 194 hours of class time, plus 8 to 10 hours of observation time. That's either with the fire department or with the emergency department at Harborview. I've asked my students currently about how much time do you spend outside of class, reading, studying for the tests, and practicing the skills. And they guessed probably 5 to 10 hours outside of class. So you're in class around 60 to 20 hours a week, plus 5 to 10 hours outside of class, working on practicing your skills and reading. So pretty rigorous, but very, very doable. Because we are accountable to the State Department of Health and we are a certificate program that gets you a healthcare certificate, we do have to take attendance and we do have to maintain that so we can meet the minimum requirements for the Department of Health. So you can't miss more than 8 hours. The only reason I throw that out there is because sometimes I have people who will register and then tell me they're going to be gone for 2 weeks for a vacation. So I just want to make sure that you're planning ahead for that. You can't miss more than 1 day. So I always get questions, can I do it? I've already shared with you that it's rigorous, that it's very time consuming, but can you do it? I would say absolutely. If you think about it, it's only 1 quarter. So it's 2.5 months, right? And I think for 2.5 months, you can do anything. Many of my students work full time and have families, they have kids, and they're in class and they are able to do it. Certainly, you're gonna miss out on some activities with your friends. Certainly, your social life might be impacted a little bit. But again, for a goal like this, it really is just full-time school, and you're already used to that. So I would say yes, 1,000,000% yes, you can definitely do that. You just need to be committed to it. You need to be dedicated to doing the work for it. Our cost is around $1,500. I can't remember the exact amount. So the EMT class is mostly fee-based. A small amount is state tuition, and the rest are fees, and that is around $1,300. Plus the CPR class is another $140 plus your fees, right? There's always a technology fee. There's always something like that. So I would say it's around $1,500. There are a couple of scholarships that I'm aware of. So I'm happy to share that information with you later. You could look at Medic One Foundation. Pride Foundation has a scholarship, and I just learned of another one for Latino students that I don't have a lot of information on, but I can forward you that email if you're interested in it. But very, very doable. And I do understand that Seattle Promise dollars do qualify. This class does qualify for those Seattle Promise dollars as well. Equipment and materials, you do need to buy the books or rent the book. I think I got a question. Well, I'm almost done, so let me finish up and then we'll add to questions. We do have the equipment and materials. So there's the student kit. You need your textbooks, and there are 2 required textbooks to go through, but very affordable and very, very doable. All right, I am ready to answer your questions if anybody has some. I'll hang for a little bit for sure. But I'm just really thrilled that you wanted to learn more about this. There are some, again, good opportunities, great stepping stone, a great place to start with your career, and just really is such a fun job. I never get bored. Of course, I'm here, so I do work for the college, but I also work for one of the ambulance companies, and I'm never bored. I get to see different people and be in a different place every single day, and it really is wonderful.
Yes, hi, I have a question. Yeah, sorry. Yeah, my name is Faduma. I'm a student at Seattle Central. Just looking for a path in healthcare. So this is my question. As a short-term goal, do they offer after taking this certificate a part-time job, or just you have to work full-time?
That is a great question. The best place for you to apply in that, if you want to be firefighter or police over those civil service jobs, full-time only. If you were interested in working for an ambulance, one of them locally makes you work for 6 months first so that you can really understand how to do the job well, and then they'll let you go to part-time. The other one is based out of Everett, but they have ambulances from Puyallup all the way up north, and they will hire you part-time. So not everybody does it. There are 4 ambulance companies in this area. 2 of them allow for part-time, but again, one of them makes you work 6 months full-time first.
Yeah. So for the students who are looking for a career in healthcare system, like let's say become a nurse and then just want to continue or not, doesn't want to take a break, 6 months, like how is it possible to manage between both things?
Yeah, I mean, so one company will hire you part-time. So you would just want to make sure that you worked for that company. It's called Northwest Ambulance and they hire part-time. One of the other things that is pretty cool about most of the ambulance companies in this area, gosh, probably half of our cars, many of our cars are EMT only, but there are several CCT cars. That's critical care transport that has one EMT and one nurse on it. So a nurse could work for an ambulance as well. So if you are already working as an EMT for that company and you're working part-time, you could go to nursing school full-time and then turn around and almost guarantee that you've got a great job waiting for you when you're finished.
Okay, thank you so much.
Yeah, great questions. Thanks. Kind of just wanted to wait for some more questions, but I could talk all day long. So happy to chat with you guys some more. I definitely think it really is. It's just a wonderful job, wonderful place to start. And again, I just want more for you in your life than an $18 an hour job. But what a cool spot to be in to start with, right? While you're in school. $18 to $20 an hour is pretty good when you get super flexible schedules. You might only work 2 days a week and you could still do full-time school as well. So super great opportunities for you and just so much fun. I went to EMT class again here at North when I was 18 and I'm 45 now and I have loved every bit of my career. So definitely want to recommend it to you guys. My email address was up there and we can put it in the chat room later, megan.bloomingdale@seattlecolleges.edu. And I'd love to help you guys out and answer questions. And if you ever just want to come visit me at class, I'll show you what it's like. You can just be my guest for an hour or for a day, and you can just watch what students are doing right now. We'd love to have you. So looks like our breakout room is closing in 12 seconds. I don't know if you get the same alert as me, but it was so nice to meet you. And I wish you well with everything. I'll be back presenting on Wednesday for fire science.